Hello everyone, welcome to my YouTube channel. So today I'm going to be talking to you guys about one of the questions that someone has been asked. Someone was asked when the person went for interview in biochemistry. So the person has been asked a question around water deprivation test. So we're going to look at that in detail. But before we continue, my name is Dr. Emmanuel Obodo. I'm a biomedical scientist and I'm also a lecturer in biomedical science here in the United Kingdom. So yeah, let's get into this. So this person had gone for an interview and the person was asked this question: why is water deprivation test needed? And tell me about it, what you understand. By the way, I try not to paraphrase this. I cannot put in the question exactly the person wrote it. So now, but it means that there are questions they are asking here. They want to find out, why do we need water deprivation test? Then they want you to talk a little thing about it. And of course, what do you necessarily understand about it? So we are going to look at that in detail, okay? First of all, you need to know that when we talk about water, we already know what water means. Deprivation means that you are starving the person of water, then the test is what you are doing, okay? So what this test helps us to do is that, first of all, remember I say, why is water deprivation test needed for? So now you are looking at one of the reasons is it helps to diagnose diabetes insipidus. Now also it can help to characterize by excessive tests. So it can also help to know whether the problem is due to, it can also to help to characterize the causes of excessive tests when someone feel, you always want to drink, as the case might be, okay? Now, of course, it helps to also look at the excretion of large amount of diluted urine. So once you do, these are the things it can help you to do. Now, obviously, it then work as a differentiation as well. So in addition of throwing more light in diagnosis of the diabetes insipidus, and also in characterizing the primary cause of excessive tests, then of course excretion of large amount of diluted urine. One other thing it does is to be able to differentiate things like central diabetic insipidus, okay? Remember, before I continue, I think I might mention it as I move on. There's a difference between diabetes insipidus and diabetes mellitus, like when you talk about your type 1 and type 2, as the case might be, okay? So there is a huge difference there. So they are not necessarily the same. So this water deprivation test can help to differentiate central diabetic insipidus from nephrogenic diabetes insipidus, and of course primary polydipsia, which needs extreme test when someone can uncontrollable continue to feel extreme test, feeling like to drink. Now this is where I'm going to let us know that there's a difference between insipidus, though two of them are diabetes, but there's a difference between insipidus and mellitus, okay? Now, first of all, you need to know that when we talk about diabetes insipidus, which is DI, is not the same as diabetes mellitus, which can be DM. So whether you talk about type 1 or type 2, as the case may be, remember that in diabetes mellitus, you're looking at whether it is insulin related or not insulin related, as the case may be. So it's more different when we look at diabetes insipidus, okay? Now, although this diabetes insipidus can share similar symptoms and signs with diabetes mellitus. Why? Because they are all diabetes. They can share similar signs, okay, and symptoms, but they are different. Does that make sense? Now, there are two main symptoms that can be associated with diabetes insipidus. Number one is extreme thirst, which is polydipsia, and number two is what we call peeing a lot or even at night, and that is called polyuria. So both polydipsia and polyuria is the common cause, or symptoms that are associated with diabetes insipidus. Now, what that happens in a very severe case, the person is likely to, that polyuria can lead to maybe someone peeing up to 20 liters of urine a day, which is, can be quite a lot. Now, why the water deprivation test is needed? Why exactly do we need it? I have already mentioned that it can help us to be able to diagnose diabetes insipidus, because the issue around diabetes insipidus has to do with the ability of the kidney to be able, or the blood to be, or the body to be able to regulate the amount of water retained and the amount of water excreted. So once there is imbalance on the amount of the water that the body should retain, or that may lead to too much excretion, the person continue to frequently urinate, or maybe, and that can lead to too much thirst and all of that. So anything around that dysfunctioning of the kidney not being able to regulate this very amount of water, whether reabsorbing or secreting, as the case may be, that is where you now look at diabetes insipidus. While militis talk about insulin, as the case might be. So now, why we need this is because it can help to diagnose diabetes insipidus. Why? Because patients with symptoms of polyuria or polydipsia, like I've mentioned. So polyuria, too much urine, and polydipsia, too much test. Does that make sense? So it can also help to differentiate types of these very diabetes insipidus. So in addition to help to diagnose diabetes insipidus, okay, it can also help us to differentiate different types of diabetes insipidus. Remember, we have already mentioned central diabetes insipidus, and this can be commonly caused by deficiency of what? Anti-diuretic hormone. Remember that this hormone helps to regulate the amount of water that is being regulate the amount of the water in the body, as the case might be. Okay, now of course we also have nephrotic diabetes insipidus. Okay, this again can be due to kidney insensitive to this very ADH. Okay, so even though the anti-diuretic hormone, which is ADH, could regulate the water, the amount of the water in the body, the kidney might be insensitive to it. And if the kidney is insensitive to it, it means it's not because of the deficiency of ADH. It's basically the kidney is not recognizing the impact, the stimulation of this very ADH, and that can lead to nephrotic diabetes insipidus. Okay, so it helps to differentiate it. Now, of course, there's also another cause, which is primary polydipsia, which is, like I've mentioned, excessive water intake. So what does that really mean? It means that this water deprivation test can help to, one, diagnose the very diabetes insipidus, and also help to differentiate diabetes insipidus. Then you can now look at the different types, like I mentioned: central nephrotic diabetes insipidus, and primary polydipsia, which has to do with excessive water intake. Now, let us look at the understanding aspect of this. Okay, we need to understand the water deprivation test. What are really the procedure? What is our understanding about it? So my opinion about this aspect of the answer is that the understanding has to do with the procedure that is actually involved. Okay, in the procedure, you might need to consider the baseline of measurement. Remember, when you are measuring that, okay, you now need to look at the patient weight, the urine osmolarities, okay, and blood osmolarities are measured before the test began. Because remember, when you talk about the regulation of water, okay, you may need to also look at osmolarities, okay, which has to do with the number of particles of solutes, per liters of solution. So when you are measuring, meaning that when we talk about water or fluid, as the case may be, so that fluid will contain some particles or solutes. Okay, so measuring the amount of these very particles or solutes in that liquid substance, in that watery substance, in that water, okay, is what we call osmolarity. Or do you understand me? So now, in understanding the water deprivation test, we mean that we are depriving the person water. That means we now need to look at the osmolarity aspect of it, because if water is deprived, the osmolarities somehow may be directly or indirectly affected. I hope that makes sense. The rate of osmolarities can be directly or indirectly affected. So one of the aspects of the procedure is they look at the baseline measurement, look at the weight of the patient, the osmolarities of the urine, the osmolarities of the blood. Okay, now we measure that first. That can now help us to know, by the time we deprive this person of this very water, what can then happen? We can now compare the result we have before the water deprivation test. I hope that makes sense. Now, the next is to look at the fluid restriction. So we are going to restrict the fluid, like I've said, from this patient. So patient not allowed to drink any of the fluid for a specific period, usually for 8 hours. So that is a way of depriving that person. So when you hear the word water deprivation test, I've already said we are stopping the person, we are starving the person of water for a period of time. I hope that makes sense. So we consider fluid restriction. Now, during this time, the patient's urine output, urine osmolarities, and blood osmolarities are monitored at regular interval, because we want to find out, now that we have deprived this person of this water, what will be the effect in the overall urine osmolarities and blood osmolarities, and that can help us to give us indication of what is really causing the diabetes insipidus. I hope that makes sense. Now, aspect of this in procedure continue is by monitoring. So what it means, we now need to monitor the person. So we monitor the test. So the test continue until one of the following endpoints is reached. So we continue monitoring that, these osmolarities and all of that. So we're going to monitor it until we reach any of this. Number one, maybe the patient has loses maybe 5% of their body weight, okay? So, or two, maybe the person have, urine osmolarity have stabilized, okay? Is less than 30 osmolarities per kg, okay? So that is changes in two consecutive samples. Now, we also look at maybe plasma osmolarities exceeds a certain threshold, which is usually between 295 to 300. I hope that makes sense. So if we reach any of these, which could be either the person has lost 5% of their body weight, or maybe the urine osmolarities has stabilized, like less than 30, okay? Or maybe the plasma osmolarity has exceeded a certain threshold, usually around 295 to 300, then it means we can then stop. We continue to monitor the person. When we deprive water from the person, restrict the person from drinking any fluid, we now monitor it. If we reach any of these three, any of them, it could be the first one or the second one or the third one, we stop, okay? That's how we monitor that, okay? Now, so now we are going to look at the results, of course, that we are going to get after the procedure and all of that. So let's look at the result. The first result, remember we thought about three main types of the diabetes insipidus. So number one is going to be central diabetes insipidus. How will you know that is central diabetes insipidus? So in your interpretation, how you will know is that if urine remains diluted, that means there is low osmolarities, despite rising blood osmolarities, meaning that there is the osmolarities of the blood is high, but the urine remain diluted. It's a strong indication there's a lack of what antidiuretic hormone. We're supposed to regulate this very urine production. I hope that makes sense. Okay. Now, what it means that in such situation we can actually decide to give the person desmopressin. And once we give the person desmopressin, it's supposed to regulate this is a synthetic ADH, and that will be able to increase the urine osmolarities. And once that increases the urine osmolarities, it then confirms that this person is having central diabetes insipidus. I hope that makes sense. Okay, so the urine is diluted. Okay, that means there's a low osmolarities, and this occurs even though there is high osmolarities in the blood. So that is not consistent. That it means that something is happening, and it indicates there could be lack of ADH. Okay, so and this lack of ADH, we're supposed to help to control this very water intake and all of this water level and all of that. It means that lack of that ADH is why there is high amount of osmolarities in the blood, even though the urine appear diluted. I hope that makes sense. Okay. Now, what it means that in order to encourage the very lack of ADH, we cannot decide to give the very desmopressin, which is a synthetic form of what ADH, and that should be able to increase. If that do increase urine osmolarities, of course, it now confirms that this is actually CDI. That means central diabetic insipidus. I hope that makes sense. Yeah. Now, talking about that as well, let us look at the maybe in terms of a nephrogenic diabetes insipidus. So remember about the other one, the urine appear diluted, which is a CDI. The urine appear diluted, but the blood osmolarity is high. So that means there may be something wrong with the ADH, which is supposed to regulate these very osmolarities. Okay, and that is why we can give that desmopressin. Now, but look at this very nephrogenic. What you are going to notice in nephrogenic is that it may not be due to lack of ADH. It's not that maybe the kidney is not recognizing it. It's not responding to it. Okay. So if the urine osmolarity remains low and does not respond to this desmopressin, so now even though the osmolarity is low, like we see in CDI, and you give the person desmopressin, we should actually regulate that. Okay. Now if after we give that, but still the urine osmolarities, which is supposed now to be high or normal as the case may be, but it remain low, meaning after giving desmopressin, the urine osmolarities, which is supposed to come back to normal or high, okay, now is low. What it then means is that the kidney is not recognizing that very desmopressin. So in such situation, it suggests that the kidney are not responding to ADH, which cannot be a strong indication of what NDI. I hope that makes sense. Okay, so I'm trying to tell that when it comes to CDI, it means that it could be problem with the ADH. Okay, so once there is lack of ADH, the remedy is just give desmopressin, and that will bring the osmolarities back to what it's supposed to be. Okay, but if you notice that the urine osmolarities remain low, okay, even though the person has been given desmopressin, there's a possibility that it may not even be lack of ADH. So of course that means ADH might be there and the kidney is not really responding to it, and that is why you continue to get low osmolarities in urine. Okay, now of course the last one has to do with the primary polydipsia. It's a little bit different from what you have in terms of CDI and NDI. In this case, it's not a question of whether there is ADH or there's no ADH, or the body is or the kidney is recognizing ADH or not recognizing ADH. The problem here is that there is a high level of test. So the person might likely to drink too much water, and obviously that's why the person is urinating frequently. So because of that too much test, so the problem is the too much test. The person continue feeling thirsty all the time and continue to drink, and obviously the more the person drinks, the more the person have to put it out. I hope that makes sense. So if urine osmolarities increases significantly during water deprivation, so you've deprived the person water, but the urine osmolarity is still high. So without the need of desmopressin, remember when the osmolarities of the urine is low, that's when you're supposed to give the desmopressin. But now you find that the urine osmolarity is still high, so there's no need for desmopressin, and you find out that it continues to be high without the need for this very desmopressin. It's a strong indication that this person is having primary polydipsia. So it's due to high test. I hope that makes sense. Yeah. Now let us look at the key point that one needs to note. Remember that if you are depriving somebody water, it's very, very complicated. So you need to make sure you ensure the safety. So meaning that we need to test more. The test must be carefully monitored to prevent severe dehydration. You don't want the person to be severely dehydrated. That will not be good for the person, because that can lead to complications, especially when it comes to children. Now another one is preparation. You need to prepare the patient very well. So patient should be informed about the test duration. That means how long it's going to take and potential discomfort the person is likely to have, especially when it has to do with the fluid restriction. And another one is a follow-up. Then we need to follow this person up, the result, and from the result we'll get whether it is in terms of central diabetic insipidus or nephrogenic diabetic insipidus, whichever one it is. We now need to further see how we can investigate that during our follow-up, and that can lead us look at things like MRI scan, or as the case may be, or MRI scan in terms of CDI, or genetic test in terms of NDI. So these are some points to note. Now let's look at the conclusion. Conclusively, it is important for us to know that water deprivation test is crucial diagnosis tools for what? Accurate diagnosis and differentiation of what? Types of diabetes insipidus. So that is why it's important. It helps us to diagnose diabetes insipidus. It helps us to differentiate diabetes insipidus, whether it is central diabetes insipidus, nephrogenic diabetes insipidus, or maybe primary polydipsia, as the case might be. Okay, now we can now look at the treatment aspect of it, strategically leading to appropriate and targeted treatment strategy. What it means, with the effective diagnosis, we can be able to know what we cannot, how we can be able to manage or treat the person. So that is why it's very, very important. So if you do go for interview, they ask you why water deprivation test is important, what you understand. Here you go. So it is important for the things I've just mentioned, and I hope that makes sense. Okay, anyway, thank you for listening. I hope you enjoyed the presentation. Do let me know what you think about the video. Please, can I ask you to subscribe, share, like, and comment? Thank you very much till I come back away again. And one more thing, can I ask you, please? I'm going to show you a video on the upper link. Please, if you can watch it, and like I've mentioned on my previous video, please do let me know if you're happy to join the online fellowship that I'm doing. I'm more than happy for us to work together to see that beyond getting a job as a biomedical scientist, that there is more to life, that we need to serve God. So anyway, let me know if you're happy. Inbox me on the WhatsApp number there, or maybe email me, and I'll be more than happy for us to talk further. Thank you very much, and I wish you all the best. Bye-bye.